Hi there, everyone. It is 1:01 on Wednesday. Welcome to the ACSA Legislative Lunch Break, along with Edgar Zazwata, ACSA Senior Director of Policy and Governmental Relations. I'm Naj Alikhan, ACSA Senior Director of Marketing and Communications. We are honored to have you with us on the show today. We were off last week. We got a big news day today, so we are happy to have you. Go ahead and jump onto our chat today. Say hello. Let us know where you're coming in from, what's happening in your district. We already have so many people on board today. Ann and Philip and Carol and Matthew. So good to have you guys here. Edgar, how was your vacation? You've been gone for a couple of weeks. How was it?
It was good. I'm happy to be back. You know, I tried to stay away from the email. I tried to stay away from the tags. It was somewhat successful. I know I ran into you over the vacation there. But all told, I'm happy to be back. And it feels like it's been a while since the both of us have been in here, right? And I think if we learned one lesson, you know, and I guess this is why we got to keep this going. It doesn't seem to work as well when it's only one or the other. So, you know, hopefully today goes well. Now we got that back to the formula that's worked for a while with us.
Yeah, there's one thing that I can definitely say. Our viewers have a lot of patience after that last show that we did where I ended up talking to myself for several minutes. Yeah, go ahead and jump on board. As we're waiting, because we have a big news day and we want to make sure that we have as many of our viewers on as possible, I just want to take you behind the scenes with the ACSA family here. Now, all of our loyal viewers know that Edgar and I have been very involved in the youth soccer community here in the Sacramento area for years, as long as he and I have known each other, coaching and soccer boards and all of that. Never have we actually been at a tournament or a match at the exact same location, but that changed this weekend. We'll pop up a photo for you. It completely changed this weekend. There we are. There's Edgar with his daughter, Ava. That is my daughter, Lily, and I. We are at a Sacramento United tournament. But here's the kicker to this. Our daughters actually played against each other on Saturday. And Edgar, I will share this with you. The impartial scouting report from my daughter about your daughter was, even though the game was well in hand, your daughter was still bringing it till the end. I have to imagine as a coach and dad, that's exactly the kind of impartial scouting report you like to hear.
I love to hear that. And you know, now we're talking about the perspectives from our daughter. My daughter was very disappointed. So yeah, she was guest playing, not her typical team. But the thing she was most worried about, she's like, I didn't have my best game, and all I know is that your coworkers and his daughters, that's going to be the impression of me, right? So just the teenage mentality there. It was actually nice. I was in coaching that week, got to see my kid just as a parent, which I don't always get to do. I know that's something you appreciate as well, but it was fun running out there, running into you. We'll have to figure out a rematch there, since the Elk Grove IR got the best of our little club there.
Yeah, we'll have to figure that out. We'll get the boards on the prowl for that. All right, so let's go ahead and switch today, Edgar, because we do have this breaking news today, and we've got a lot to dive into, and a lot of guests to join us here. Go ahead and submit your questions in on this new mandate. But this came in from the governor earlier today, that they will now require all K through 12 teachers and educators at all levels to be vaccinated or tested. This is the first mandate of this kind in the country, and it follows similar mandates that were established in other California school districts over the last few weeks. Those districts: San Francisco Unified, Long Beach Unified, Oakland Unified, Sacramento City Unified, and San Jose Unified. This mandate, we've been told, had widespread labor support. This new policy will take effect on August 12th, which is tomorrow, full compliance by October 15th. And Edgar, I want to just read a couple of quotes, and then I'll have you add in and clarify anything from Governor Newsom this morning. He said, quote, the state tries to lead by example, align school strategy with the state strategy, sustainable way to keep our schools open. And we think this will be the best received and right thing to do. So as we have that, Edgar, details that you have and anything additional.
I mean, big news, right? Like, and this is all materialized pretty quickly over the last weeks and months, and we kind of seen this kind of picking up momentum in terms of what really, it's interesting because I think the school community really led the vaccination effort early on, where there was this huge push to get educators vaccinated. Almost all of our members took up the pop-up vaccination sites, and I think with great success. And I know the governor cited some of the statistics in terms of what teachers and educators about. I think the percentages are higher probably than the population as a whole. Now, with that said, we've seen what's happened over the last weeks and months is that those rates have slowed down, and we've kind of hit a place where there hadn't been a lot more vaccinations. And as the trend has been, we've seen what's happened with the Delta variant. And as the governor has said many, many times, this has led to some extraordinary actions. And I think this was the next domino in terms of we're doing this for schools. The governor made some headlines a couple of weeks ago when he did this for state government. There was a lot of questions about, okay, if you're doing this for the state as a whole, what about schools? And the answer today was that they were looking at this and they thought that this was the appropriate measure to really try to keep students and staff safe. And then also from a public health standpoint, trying to really stifle this surge that we're seeing this summer. I think the one important detail, I know you probably mentioned it, I know we're going to have to mention a number of times. We know we're at the start of the year here. You know, some have started this week. Some have already, as we were going to hear from some of our guests, they've already been in session. This requirement, while the order is going to go into effect here in a couple of days, the implementation deadline is actually October 15th. So I know that's going to be a big concern to our folks of like, how do we put this in place? What does this mean operationally? They did cite that October 15th is going to be the date where all school districts, schools will have to be in compliance.
And again, folks, go ahead and jump in with your comments and any questions that you have. We have Edgar's entire team is behind the scenes right now, trying to gather information, anything late breaking, and getting some details on the questions. I saw Michelle Eklund, our good friend from Placer County Office of Education. She has one for us, and Angela Shull, our loyal viewer as well. So we'll get to those as we bring in our first guest. Wes Smith, ACSA Executive Director, is with us. Wes, welcome back to our show. Let me just get your initial reaction to the governor's announcement today and the next steps forward.
Yeah, I guess the initial reaction is we weren't surprised. I think when the governor made this similar mandate for state employees, folks around the state were saying, well, what about public education sector? Because it's the only state environment where you have most of the individuals in the room unvaccinated because of their age. So it wasn't a surprise. As far as the second question, you know, what comes next? We've got to get the resources that the administration and others have promised to our members so that they can address those operations, managing this, as Edgar accurately pointed out a second ago. So that's task number one, get them the resource support they need and clarify where we can this mandate.
Hey, Wes, go ahead.
I jump in there, just a quick question. Obviously, all of this happens, we see what happens publicly. And I think at ACSA, we've been in a good position given the relationships we've built up with this administration, where we've really tried to be a resource for them throughout this whole pandemic. Maybe just take us behind the scenes here a little bit in terms of some of the considerations as we know some of this has been playing out, and then give you an opportunity to talk about us putting in front of them some of the biggest pieces that we know are on top of the list for our members.
Yeah, it's a great question. And, you know, I understand that people around the state have different political viewpoints. And they see this differently, which is fine. The administration has treated ACSA very well in the sense that they reach out to us. They're very proactive. They want to know how our members are going to respond or things they ought to be thinking about as they design these orders or mandates, et cetera. And that was true again in this instance. They were reaching out and saying, you know, how would this impact folks? And, you know, since I've been at ACSA for 8 years, we don't make assumptions on behalf of our members. So I was able to late at night get a hold of quite a few of our leaders and say, hey, what would concern you here? Every single one of those individuals thought it was the right step to make, because anything we can do to increase the safety in our schools, in our districts, in our counties is a step in the right direction. But they had some concerns. Number one, that if it was going to be bargainable, they would never really get to implement it anyway. So it had to be a mandate, and it had to be clear that this wasn't something that we were going to bargain. The other part was that operationally, it's a real challenge. A lot of districts went with the self-attestation. So they're just collecting, yay or nays from folks. And now they're going to have verification. So there's going to be some work on that end. And then I think even more significantly, the needs around testing itself. As one superintendent told me, don't send me free tests. Don't send me money. Send me bodies. Because right now I can't find anyone to administer the test for what we've already got in place. And so we shared this with the administration. And so they knew going into this that they'd have to address, getting labor management together, which has happened. I applaud our labor partners. I mean, what they've done in those large districts that you mentioned, Naj, I've heard that Los Angeles Unified may be following suit. But what I've heard for sure is that we're in agreement statewide on this. So that's powerful. And then the governor's office also said they'd be working on supports in the form of personnel to help with the operation. So that's huge. We were able to ask our members, we were able to inform this and get some necessary supports for folks. And so as I said a minute ago, our next step is making sure that those promises are realized in the field.
Hey, Wes, you mentioned feedback that you were getting from some district leaders that you've spoken with since the governor's announcement. Can you just kind of summarize what you've been hearing from district leaders, what they're saying in response to the governor's announcement?
Yeah, like I mentioned, they feel like it's a step in the right direction because it increases safety. Our members, as Edgar pointed out, have been instrumental really in elevating the need for vaccinations. There are a lot of frustrations around the state, depending on who you're asking, about masking. If we want to avoid that, then we've got to prioritize vaccinations and continue our advocacy around student vaccinations, because that's the answer that our members have given us. So they appreciate the step in this direction. They want to do more in this realm of vaccinations for staff and students. And then again, they lifted up the operations, that there are going to be some challenges there. They're very honest with us, and they've continued to be honest in this regard. This will be impossible without certain supports at the local level. I think what's interesting too is that half of the people that I called were already intending or had made this a district policy anyway. They'd already decided that they were going to do what we heard Oakland, San Francisco, and San Jose did. So folks were already moving in many places in this direction. This mandate certainly helps them.
Hey, Wes, before we let you go, I know you like to ask this question, but we're going to throw this question to you. With this new development today, what brings you hope, especially with schools? Some schools are already in, some are starting this week. What brings you hope as we start moving forward?
I was chatting recently with some folks in the healthcare profession, and they were once again pointing out that until we get enough of our educators and students vaccinated, these variants, these mutations are going to continue to plague us. We've got to do more in this regard. What gives me hope is we're lifting up again the importance of vaccinating the adults. And hopefully this urges people at the federal level to approve the vaccine for our youth so we can protect them also. So it gives me hope that we're elevating the right conversation. It also gives me hope that we have labor management working together on this, and that we're looking for solutions and not identifying our problems. Solutions like, hey, let's provide support for the field so that they can do this. So those three things give me quite a bit of hope.
ACSA Executive Director Wes Smith. Wes, thanks so much for being with us today. We appreciate it.
Always fun. Always fun. Hey, give me better lighting next time. I look 90.
You know what? We'll put it in Edgar's budget. Why not?
We'll talk to the boss about that. We'll put in a request.
We'll put in a request for it. Absolutely. Wes,
great job.
Hey, just so you folks know, I got a running list here of individuals who have asked questions. Angela, Teresa, Matthew, Morgan, Virginia. We will get to as many of these as possible before the end of the show. Let's bring in our second guest, Charlie Hoffman, ACSA's president. He's also the superintendent for Shasta Trinity ROP in Bella Vista Elementary School District. Charlie, so good to have you on the show, a loyal viewer. We're always so happy to have our viewers on the show. Let me just ask you about your initial thoughts to the governor's announcement today.
Hi, Nosh. Hi, Edgar. Good to see you guys again after your vacation. We missed you. As you know, I'm a loyal viewer and would be watching today if I wasn't on the show with you. My initial reaction was strongly positive, strongly supportive, really echoing what Wes just said, with the caveats of concern and in need of assurance that it wasn't going to be a mandatory subject of bargaining, that it was truly a mandate, and that we would have boots on the ground support for administering the testing protocol. I saw in the governor's office press release this morning that there was simply a reference, a link to click to the California K-12 schools testing program. And we're going to need more support than a link where we can go and read about all the different things we could do testing. And when I've talked with other superintendents, other principals in the last couple of days, that was the first thing they brought up as well. Especially at this end of the state, I think our vaccination rates of both our public and our school employees are significantly less than the rest of the state. You know, up here in Region 1, we're also known as the state of Jefferson. And there's considerable anxiety among folks that aren't already vaccinated. And so we're anticipating a lot of testing, and many of us are really small school districts. So small school districts with less resources to manage a testing protocol, testing program, compounded with a higher than average proportion of our folks that are not vaccinated that will need the testing. So that anxiety stated, strongly supportive of the action.
Hey, Charlie, you just noted, and as you stated, coming from the state of Jefferson, knowing that we're a very diverse state. And I think this is the beauty of ACSA. When we have to take these type of things into consideration, we're taking the different perspectives of different communities. You being our president helped convene our executive council. The governor's office was asking for some reaction. ACSA executive committee decided that this is something we want to support. Given the diversity of perspectives, maybe walk us through some of the decision making, just in terms of taking the bigger picture into account. I know that was something that you referenced in your quotes to the governor's office, and I think it's worth just repeating.
Well, my first awareness in terms of walking through the process was I was one of the folks Wes just referenced that he called on Monday. And I don't think he was quoting me in the things he said, but the things I said to him, he was also hearing from other folks. And we agreed that if this moved forward, we would need to convene. We didn't have time to convene the whole ACSA board of directors, but we could convene the executive committee of the board, which situations like this are why we have that. And we were able to convene not 100% of the members of the executive committee because apparently folks are busy trying to open school. But we were able to get together with about half the executive committee, and support for the order, the action, the order was unanimous with the exact same concerns relayed by everyone on that committee, including Gina Potter, who I believe will be a guest later on in today's show. We need support. We need boots on the ground support, not more money, not a box of tests sent to us in the mail. We need support in administering the program.
Well, Charlie, you said boots on the ground. So let me ask you about this Delta variant. How has this changed the narrative as far as public education, because you said state of Jefferson, the discussions are different no matter what part of the state you're at. But has this kind of changed the narrative?
Well, you're asking for opinion here, but my opinion is it's elevated student safety as part of the conversation. All reports, data seem to indicate that children are more susceptible to the Delta variant. And again, especially up here in this part of the state, one of the criticisms we have recurringly heard over the last 18 months is this is a high danger to older people, especially older people with other health conditions. But for students, it's really not much more dangerous than influenza. We've never shut down schools for flu season. We've never required students and teachers to wear masks during flu season. Why are we doing this? Well, all indications at this point are with the Delta variant that there is an enhanced danger to our students, and we all place student safety at the top, maybe not as our highest priority, but certainly as a foundational priority. If we haven't taken care of student safety, we can't do all the other things that are what we're here to do. And so that's not new in the conversation, but it's certainly a higher rank in the conversation just in the last month or two. And the idea of having school employees possibly vaccinated and not showing symptoms, but be unknowingly infected, shedding viruses and exposing children who are required to be at school to infection is it's not a comfortable notion for anyone, wherever they are on the political spectrum. And that's become more significant in the narrative, I believe.
Charlie Hoffman, ACSA President, Superintendent of Shasta Trinity ROP and Bella Vista Elementary School District. Charlie, good to see you. Honored to have you on the show, and we'll see you next time.
Thanks very much for having me. Have a good day, you guys.
Thanks. Edgar, let's do rapid fire just for a few of these before we bring our next guest on, because I want to make sure that our members have a chance to get some of their questions answered. I'm going to go to Angela Shull, who gave us a question at 108. She says, has there been any conversation about mandated student vaccination for those who are eligible? Any word on that, Edgar?
Not yet. There's always a chance that could change, but the short answer is no, that hasn't been part of the conversation at this time.
Okay. Teresa Healy also has a question. All staff or only those at school sites? I believe, Edgar, that it was asked in Newsom's news conference, but it is all staff, correct?
Yeah, and this is there's a number of questions related to this, and Surratt on our team has been doing a great job trying to touch on this. Let me try to quote the order a little bit, because it'll clear up a couple of this. They refer to workers, and worker refers to all paid and unpaid adults serving in school settings that are described in the order, and the workers include, but are not limited to, certificated, classified staff, analogous staff working in private school settings, and volunteers who are on site on school campus supporting school functions. So they try to clarify that. Undoubtedly, there's still going to be categories that we're going to have to figure out. I think I saw board members, coaches. I think coaches is a given, yes. I think volunteers is a yes. The board members, I think that's open to interpretation a little bit. We'll ask the questions. But in general, I think that the intent here is to be pretty far-reaching. Anybody that's on a school campus, anybody that's interacting in the school setting, I think that goes for school employees, even if you're in the district office. I think the idea here is not just interaction with kids, but from a public health standpoint, the state's just trying to get as many people vaccinated as possible. So I think that the short answer is, if in doubt, it's probably going to be yes.
Yeah, and I think you just answered Terry Cohen's question about volunteers and Matthew Tinsley's question about preschool teachers, because both have their considerations. So we got those out of the way. Let me move on to Mary's question. Does order require LEAs to provide testing to employees, or can LEA tell employees to use community testing sites to meet requirement, assuming they must then submit the test results to the LEA. Okay, now this comes down to an accountability question, Edgar, which is something that it was a question that the governor, a reporter posed to the governor during his news conference about accountability. So there are pieces in ed code that are responsive to something like this. Are we hearing anything that could go with Marie's question?
Yeah, and I don't want to speak out of turn, and I know Sarat will probably give me some guidance here, and I'll come back and speak more intelligently on this one. I think the bottom line is what's different about this is the onus they are asking for verification. Like the employee has to either get vaccinated or get testing requirement. The governor did cite the resources that we've gotten, and I know CDPH, as Charlie stated, they're going back to what are the resources that are already available for schools. Now, I think what the legal question here that's being asked that I think we'll dig in a little bit is requirement. Okay, does the district actually have to offer up that testing? Let's dig in on that one before we speak out of turn. But the governor's office is trying to make note of like, here are all the testing resources we have for you. I think what we're going to do, where our impetus is going to be is, as Charlie stated, this goes beyond just giving us money or saying this is where you could go to CDPH. In many of these communities, it's the actual capacity to administer tests, to facilitate this process. I think, like Charlie stated in his quote, our hope is that most folks get vaccinated, right? That's the final result. Right. Understanding that in some communities that's just not going to be the case, we have to also prepare for the operational part of this.
Let me get one more in, Edgar, because I was wondering this too, and I was not able to find it in any of the information that was given out. And then we'll get to our final guest. Brenda Smith asks, how frequently will unvaccinated employees need to be tested? I have not seen this number anywhere.
Weekly. It's a weekly requirement, similar to what the state requirement is, similar to what other industries are putting forth. I mean, I think this has kind of been the standard now. So either proof of vaccination or weekly. I think I saw also a question about one dose versus both dose. I think the order talks about fully vaccinated. So, and Sarat will correct me if I am speaking out of turn here, but I think what the CDPH guidance has always stated, fully vaccinated talks about having, I think it's 2 weeks after your second dose, but I'll correct myself if I was speaking out of turn there.
All right, well, let's bring in our guest. Gina Potter is the superintendent from San Ysidro School District down at the border, also our vice president for legislative action here at ACSA. Gina, so good to have you on the show. Your initial thoughts to the governor's announcement today.
Yeah. Hey, thank you, Naj. Nice to see you, Edgar. In terms of my initial thoughts, I would just say that safely keeping schools open by supporting vaccination as the most effective COVID mitigation strategy is in the best interest of protecting our 6 million students and our incredible educators in California. In terms of my district, I'm just so proud of my school district, San Ysidro and Otay Mesa, South San Diego County region, because right now our community has one of the highest rates of vaccination of about 85%. When I look at what maybe some of the challenges might be for school districts to deploy the efforts of both vaccination and COVID testing, one is getting the vaccination clinics, the mobile clinics to come to our schools. We are able to work with our county health departments, and our district has done several of those at this point. Coordinating and scheduling that is really important so that people have access to the vaccinations, easy access, so it's simple for our staff to move in that direction. And then with the COVID testing, that's really going to be probably one of the heaviest lifts for all school districts in the state of California, because the COVID testing capacity likely does not currently exist in most of the districts in the state. So we're looking at COVID testing capacity on various levels of COVID testing. So to name just a few, there are different types of COVID testing that is happening in schools right now. And since my school's opened 2.5 weeks ago, we've encountered the different types of testing that are required. The first would be a type of pool testing. Pool testing is an antigen form of testing that crosses a large number of individuals in a school, for example. Thankfully, the California Department of Health currently does have an antigen testing option for school districts to engage in. That option, our district right now has an MOU from the California Department of Health that we're bringing to our governing board this Thursday, because the option allows for free access to free test kits, but also the pool testing from the state Department of Health. It's my understanding brings to our school districts the staffing required to administer the pool testing. So that's the key right there, is to really get ahead of that option of COVID testing. Contact tracing testing is a whole second layer of testing. So once you have a positive individual at a school site, then the district has to go about contact tracing and then offering COVID testing to all those individuals that became close contacts. So that's a second layer of testing. It's a different form of testing than pool testing. It's actual individual testing that would need to happen. There's also this modified quarantine testing. That would be a third type of testing that's happening in schools that are open already. That modified quarantine testing does occur on a weekly basis, similar to what the governor's new requirement is for unvaccinated staff to weekly test.
Gina, before I ask you a question, because you just touched on it, also give me an opportunity to clarify some of the pieces. And again, Sarek Kaminsky working behind the scenes, getting us all this information. There was this question about something you just talked about, the requirement. So I'm going to go back to the order, and it quotes, schools with workers required to undergo workplace diagnostic screening testing should have a plan in place for both tracking test results and conducting workplace contact tracing. And they must report the results to local public health. I know there was a question. They also go on to say that there are IT platforms available that can facilitate these processes for schools. So that's a whole other conversation, but I just did want to clarify that piece, that that is the requirement in place to have that for those that have to undergo testing. Gina, back to what you've been experiencing here in your community. You're in a unique situation that school actually started. Obviously, all summer, there's been a lot of politics about mask wearing, vaccines. Given your perspective on the ground, I think, we're all curious. How's it going? What's been the reaction? And what has been your experience here as schools have started?
Let's go to that IT platform just real quick, because I see a question in the comment, Edgar. And the state California Department of Education's testing program for pool testing, they seem to be running a program called Concentric, which does already have with it the IT platform to track all of the testing and to communicate the testing results. Another possible platform is Binax Now, and that's more that individual testing. They also have a tablet form of tracking of the testing as well. In terms of, Edgar, your question of just opening our schools, we opened 2.5 weeks ago. We were one of the first districts in the whole state to open for students for the fall. Oh my goodness, the excitement of the children to come back to school, the joy that they had, it was wonderful to see our students have this opportunity in our district. Because we had been a COVID epicenter, we had about 60% of our students who hadn't been back to school for over a year. So we celebrated that moment with balloon arches in front of our schools. We really took a social emotional learning lens for our students. And that whole first week that we brought them back, we did restorative circles to help transition them back to school. We did everything from smiling and saying, welcome back to school. And we're so happy to see you, to make the school environment warm and inviting for the children, because we were thinking they might be worried or scared, and we wanted them to feel safe to come back to our schools. And the Second Step program is a social emotional learning program. They actually created a whole week-long lesson of what to do for the social emotional curriculum lessons. And I believe Harmony probably has something similar. The third one was California Collaborative for Educational Excellence. They're all over their website is how to help children transition back to open schools from being in either a hybrid environment or virtual the whole year last year. So just an absolutely historical, momentous time for the children, and for all the adults who made that happen. Thank you so much. And for all of you who are about to make it happen for your kids, it's a moment to treasure that first day of school.
Folks, if you have more questions, go ahead and put them into our chat, because we're going to go rapid fire with Q&A as soon as we move to our next segment. Gina, I do want to ask you, because as you mentioned, your classes have been going on now for 2.5 weeks. That means you're well into the day-to-day of the in-person learning. Now we've reached this stage of there's a new mark to hit as far as the vaccines or the testing. What challenges do you see ahead with implementation of something like this when we know it goes into effect tomorrow? The mandate isn't until October 15th, full compliance. But what do you see as far as some of the challenges with implementation?
So I want to take a moment, thank you, Naj, for that question, to talk just a little bit about COVID safety staging for school reopening. For those folks who haven't opened yet, just a couple tips, if I might. In addition to the COVID testing capacity and getting ahead of that, or moving into that very quickly, there's this contact tracers. It's extremely important to have identified contact tracers before you open school. It's something that we're still grappling with 2.5 weeks into school. What we have learned is that you probably need one contact tracer for every 3 to 5 schools, depending on the size of your school. Contact tracing takes about 2 hours for every one positive case at the elementary schools, and upwards to 20-25 hours for a student at a middle school or high school who has multiple classes. Seating charts. We implemented the seating charts on the 3rd day of school. If I had to do it all over again, I would have said we needed to ask for seating charts the first day of school. So it's extremely important you've got seating charts, not just for classrooms, but for bus routes and for lunch schedules. Because once you have a positive case, those seating charts save you, and that they also keep students in school because they help you to contact trace for any positive cases that might come up in your school. Cohorts, to the degree that a school can cohort, that's really helpful. A cohort is, sending the classes to lunch in small cohorts. Again, that helps with contact tracing. And then a big hiccup that I'm hearing statewide, and certainly is happening in our district, is staffing shortages, especially with teacher substitutes. Right now, we're probably running on a day-to-day basis of teacher sub shortages, anywhere from 20 to 30% teacher sub shortages every single day. So if you can creatively work on alternatives to, what are you going to do if you open your school and every day you've got 1 or 2 classes without a sub? You need a backup plan. And then your HR can work on, how can your district attract subs to your school district to help, because COVID is causing an inordinate amount of teacher subs. Really knowing that quarantine decision tree and getting ahead of it, studying the quarantine decision tree, making sure your management team and your office staffs and health clerks know how to navigate and understand the quarantine decision tree can be really helpful. And then I'm sure on another broadcast, Edgar and Naj, that ACSA will do a deep dive into independent study. That's a complex topic that really needs some guidance.
Oh, we lost Naj for a second.
Oh, see, you would think after all of these months, I would have figured out the mute, unmute button every once in a while. Gina Potter, Superintendent, San Ysidro School District. Gina, thanks so much for being with us today.
Thank you, Naj. Thank you, Edgar.
Gina.
All right, so we're going to go to rapid fire here. I do want to reference this, Edgar, before we move on to this. We've had several school leaders make statements since the governor put out his news conference just before 11 o'clock. This one comes from Lisette Estrella Henderson, the Solano County Superintendent of Schools. She says, quote, "We know that our educators want to be in classrooms with their students, and we want to support any measure possible to ensure that our students can return to school with every safety precaution possible in place to do so successfully. Requiring all school staff to either show proof of full vaccination or be tested at least once per week is an important step to ensure a safe return to in-person instruction." That is from Lisette Estrella Henderson, County Superintendent of Schools in Solano County. Edgar, that's something we're hearing fairly consistently, that it's a show of support. I think you would agree, from our school leaders.
Yeah, I think all of our leaders across the state even understand that there's going to be challenges here. This is not the easiest thing to undertake, and kind of par for the course with what our folks and our leaders do time and time again from the beginning of this pandemic, even while understanding that, yes, is this going to be the easiest thing to do? No. And there's challenges as we're seeing through the questions. I think most of our leaders are acknowledging that this is the right thing to do, especially if we want to get past this pandemic. So I think that message has been very consistent with what we've heard from around the state.
All right, so let's go rapid fire here. Virginia Alvarez asked the question, does this mandate include day-to-day on-call subs? Have we heard that?
I would fall that into the category of the worker definition that we talked about earlier. I think on-call sub that is serving in a school setting definitely applies there.
All right. Alan asked the question, do we anticipate CSBA employees having that expectation as well?
That one's a little more ambiguous, and I think we'll have to get some legal clarity on that. So, stay tuned on that piece. I think, there might be some different legal considerations also for elected officials or serving in a governance capacity. Now, I will say, if there's a board member that in some capacity is serving, interacting within the school setting, I think the definition is pretty clear that the intent is that they should be vaccinated or get the weekly testing.
This one has been brought up a few times here on the show. Charlie, I believe, mentioned something about this. Anthony asked the question, is the state going to provide funding for the testing supplies and the materials?
One of the things the governor was real quick, one of the first things out of his mouth today is reiterating and I think this was his quote, the unprecedented amount of funding that the state and the federal government has provided for these type of purposes. So I don't know that there's going to be a new pot of funding. As Surratt has reminded us in previous episodes of the show, that there is already resources available from the state in terms of offering testing. So I think this is where in the chat she's been sending those links again. So I would recommend people go back in there. I think as we digest on this, I'm sure next week we'll be talking about this in some form in terms of the implementation aspect, reminding those resources that people can access and the different pots of money as well.
All right. Gary Reller, our loyal viewer from Matthew Gage Middle School in the Riverside Unified School District, he's got two questions. Let me get to this first one. Can those who still refuse to get vaccinated or tested take any type of COVID leave?
Yeah, I mean, the COVID leave there is, I know that a few of our members have noted that that's expiring. So I think if they meet the criteria, frankly, before then, irrespective of this action, I think nothing has changed in terms of individuals that were eligible for COVID leave would still continue to be eligible for COVID leave up until expiration. I know I also saw a question about, have we heard any extension of that? I think there's going to be more discussion of that, especially if the surge continues. I can see that being another policy discussion. So I think we'll have to stay tuned on that piece of it. The other question he asked was, remind me?
The other question that he asked, will testing start prior to October 15th?
Oh, yeah. So I think that's where Surratt also tried to clarify this in terms of the order. So it goes into effect here on August 12th. You don't have to be so ultimately, the intent here is that we start doing this. Now, in terms of being in full compliance from the state, you have to October 15th. So the technical answer is yes, it has to. You don't have to be fully compliant until October 15th. So they're giving some space, some wiggle room, and hopefully also some time here for employees to go get vaccinated. And knowing, going back to this definition of being fully vaccinated, it gives an employee some opportunity to meet those requirements.
Todd Beal asks, what happens if an employee refuses to get vaccinated or tested, refuse to provide verification? This was a question, again, that was brought up to the governor in his news conference. And as I'm scrambling for my notes here, I believe he said that there are enforcement measures in Ed Code, some progressive sanctions. I believe those are the terms that he used. But have we heard anything about those who?
Yeah, I mean, we're going to have to, we'll let the governor's words stand for what they are right now. I think this is going to be one that we dig into. Okay, what does the Ed Code say? I mean, if an employee is not abiding by the Ed Code, I think that there's grounds for dismissal there. If they're not getting testing, if they're not getting vaccinated, I think there's some mechanisms to discipline employees. It might get a little complicated with due process and whatnot. I'm sure we will have some HR experts here in the coming weeks to even go over what those processes look like for those that just refuse to do so.
I am looking for this next question. Just bear with us. Right there it is. Steve Hovey asked the question, what aspects of this mandate will be within the scope of effect for
collective bargaining? So Wes talked about this at the front end. And this is one where we were very clear on the intent. The governor's office stated their intent, right? That's not to say we know sometimes things get translated differently locally, but the intent is that there shouldn't be locally bargained requirements. And, in some of the statements from some of our labor leaders, they cited, I think there was an SEIU leader who cited that there's already been agreements in place similar to this, acknowledging that this has been done locally, and then maybe that their preference would be that it be done locally. But I think the intent here is that this doesn't have to get played out in every LEA individually, that this is a mandate. Now, what part of this do you have to actually get into contracts or whatnot? Again, that's going to be a trickier legal question, but I will say, because Wes, this is one of the first questions Wes asked to the administration staff, is that there would be no additional collective bargaining requirement with this action.
And folks, if you have any other final questions, go ahead and drop those into the chat very quickly, because we are coming up on the end here. Let me just address two things really quickly, because Ellen Wheeler from Mountain View Westman School District, one of the first to put in on the chat, what are folks doing about the independent study requirement? Ellen, we will try and hit independent study, because that is a topic that is vast, if you will, Edgar. We'll tackle that topic. And then let me see where this other one was. Morgan Nugent asked the question, has CDPH put out any guidance on youth sports? If Surratt put in something into the chat, but if you didn't have an opportunity to see it, CDPH, no guidelines as of right now, no guidance from CDPH or CIF on youth sports.
No lack of effort on our part. They're probably tired of us asking this question about when the forthcoming guidance will be coming. I think one of the things, just in terms of people preparing, I think especially what we've seen with some of the CDPH guidance, I think they're, leaning back on what some of those requirements were last year and maybe using that as a guiding post, but we'll have to wait until they put something out officially. Nothing yet.
Yeah. Surprised that we haven't seen anything since practices for fall sports have already started and we're moving towards the start of the school year. So surprised about that. All right, folks, if we don't have any other questions, I see one that's just coming from Empire Union School District over on YouTube. May we get a link or guidance to acceptable testing products? I think that we've had a few of them. I want to think I just saw Maria Thompson. She had a comment on that. I think there were a couple of other comments, but we would ask our viewer from Empire Union School District, take a look at the chat, because I do believe that there are a couple of things on there, Edgar, that maybe be able to provide guidance to those testing products.
Yeah, and I think we've put a couple of links also to the CDPH website, which also links back to the state guidance on this piece. And we just put it out there on the testing.covid19.ca.gov. We'll get you to some of that information.
Edgar, it's been a big day. Let me just ask you for your final thoughts on this. I think that when we had heard the governor put those guidelines, put the guidance, put the mandates in some time ago about the vaccine or test on state employees and healthcare workers. It was really only a matter of time before we hit statewide public educators. So I guess I'm not really surprised by the fact that we're here, but just your comments today, your thoughts.
Yeah, I think just a reflection. It's another, we've had so many of these type of days in the pandemic, right? Where it's like our folks are literally doing what they were just doing, is drinking out of a fire hose. And here we sit here, try to be the translators and whatnot. I mean, it's another testament to our folks of just constantly dealing with ever-changing variables. I will say, I'm proud of our folks. I'm proud of our organization, right? I think if we can be part of the solution, you know, as Gina talked about and Charlie talked about, today I dropped off my son for the first day of school, and I saw the excitement of them actually, you know, having somewhat more of a normal year as compared to last year. If we could do our little part to make sure we maintain that, I think we're being part of the solution. So I think hopefully this is a good step, and one that probably other states will follow.
And a lot for our district leaders to have to deal with over these next few weeks as they work through this. Edgar, welcome back from vacation. Nothing like coming back.
Yeah, there we go. Fun to be back.
Fun to be back. All right, folks, thank you so much for joining us here on the ACSA Legislative Lunch Break. We'll see you next Wednesday, 1 p.m. live and interactive here on ACSA Facebook and ACSA YouTube. Have a great rest of the day and great rest of the week.